Just so you
lean.
know, everybody, we have 20,000 pillowcases here. Please don't feel like you have to worry about the laundry bill, especially with all the sick people around here.
So notice he's side lying, so I'm gonna have him into more prone, so that's 3/4 prone. And then,
Everybody understands what 3/4 prone is, right?
yeah. Okay, so he's in 3/4 prone. What we're gonna do is do percussion for about 3 to 5 minutes. So just pretty much going through the posterior segment, just along his lungs for postural drainage. So 3 to 5 minutes. After, you guys can see.
Oh, don't worry
After
about
3
it.
to 5 minutes, we would perform shaking. So we would instruct the patient to inhale. And then during his exhalation, just perform shaking and then tell him to relax. And then repeat, inhale, and then shake. We would do this about 5 to 7 times, again, to kind of break up for postural drainage.
And so as you're teaching the patient, this is your patient, you're teaching him and what you're doing. Talk to him like he's your patient.
So what I want you to do is inhale. I'm going to perform some shaking to help break up
And exhale?
and exhale. Yes. Don't say inhale. So you're going to inhale and then exhale. And then relax. Inhale again. And exhale.
So you're only doing the shaking when he's exhaling.
Exhale.
Only
Yeah,
only
this
when
is
he's
what I
exhaling.
did.
Right.
Right. Okay.
Well, it's important to be, that I know we're all teaching each other, but make sure that we're performing these things as a lab practical. I don't need you to tell me how it has to be done. I need you to teach your patient what has to be done. Or tell your patient, if it's not a teaching moment, what you're doing. So that was the posterior segment's 3/4 prone. Remember, stay away from kidneys, people.
Okay, so the next one is sidelining.
So pretty much the same thing, it's just side lying. It's not tilted more posterior, it's just side lying. The patient is side lying. We're doing the same thing, 5 to 7. So 3 to 5 minutes percussion, and then on an exhale, we're gonna do 5 to 7 repetition of shaking. So the same thing, we're gonna do the percussion 3 to 5 minutes. So I'm gonna do some percussion technique on you to drain the fluid, and then I'm gonna do some shaking. Okay. So that I will do it for 3 to 5 minutes. So it's 5 minutes. Now I'm gonna ask you to inhale and then exhale, and I'm gonna shake. Okay. Do some shaking. Exhale and inhale and exhale.
And make sure with the sideline too that the person, we need to have their arm up so you have full access to all the lateral segments. Yep, raised, however they have to, if it's another pillow they gotta hold, or if they can raise their arm up, that's fine. That's when we were talking about if somebody has shoulder bursitis or something like that, that could be a precaution. They can't lift their arm up, you can only get it where it is. But make sure that it's out of the way for sideline.
Use lots of pillows if you need them, because a lot of these patients won't be able to do what you guys can do.
Yeah.
As far as trunk control and stuff?
Right.
Okay.
Again, if you look in your books, they show great pictures of these positions too.
The last one is quarter supine anterior.
Would they ever be inverted, like since some of these people might be in hospital beds? Is that?
Again, and yes, in your book, it does show most of the positions are in like a Trendelenburg position. However, I'm just asking all of you, don't have to do that for class.
Okay.
But yes.
Okay, so for quarter supine, it's the same thing.
And with the arm up again, because now you need all that exposure to the anterior part.
Only, the anterior part of the body is showing more, so he's gonna do the same percussion for 3 to 5 minutes.
Okay, so I'm having the patient lay down, obviously having this exposed, so we're gonna have the arm up. We're gonna do a little percussion, 3 to 5 minutes. Breathing in and out and sneezing. And then after that, again, we're gonna be having the patient breathe in, and then as he's exhaling, shaking it out. Do we need to keep his head to the side? Okay, he starts spewing out.
Okay.
Unless you're wearing a mask, maybe, I don't know. Gown.
Just,
I don't think there's anything wrong with his lungs.
yeah.
Wear goggles.
And so we're positioning him in those 3 different positions for the lobe.
All right, what would you do if their patient was a female in this position? Yes.
Ask
Put a
consent.
pillow between him and the patient, so that, as Tim says, he's not putting his junk in his.
Oh, well, actually, he's got the pillow there, so that's not what I'm thinking more about,
Do the percussion.
Of the other
right, the
drum.
percussion
What
technique.
about
So
the female?
if he's got his arm up here,
And if I'm the female?
yeah, if you're the female, does that mean we can't do this?
We call
No,
Jill.
we can't. You hope she's a little older. Yeah, no, it's not necessarily the case. But you can, that's when you really need to make sure that you are explaining to your patient what you're going to do before you put your hands on, so that they understand exactly what this entails. And when you say, okay, and I'm going to be doing this cupping, it's going to be kind of hard on your area. I'll demonstrate over here a little bit so you can feel, and then we're going to do it up here. Can I place my hands on you and show you? And she says yes. Then you can say, okay, it's going to be probably like in this area here. You don't have to stroke it like that, but in this area here, okay. and you can, it's in the shortest place. Maybe she might want to turn her head a little bit more to give you a little bit more region to work with. It may not be a whole lot, but that's okay. Oh, yeah, right above the breast. So anyways, I just want to make sure that you know that just if the patient's a female, it doesn't mean you can't do it.